Have you ever wondered how prevalent chest pain is among the general population? It's a question that might surprise you with its answer. Chest pain, in its various forms, is a complaint that medical professionals encounter with alarming regularity. It's a symptom that doesn't discriminate, affecting people of all ages, races, and walks of life. In emergency departments around the world, chest pain is one of the leading reasons for patient visits. It's estimated that up to 10% of all emergency department visits are due to chest pain. That's a staggering number when you consider the sheer volume of patients seen in these settings every single day. In primary care, the situation is no different. Chest pain is a common complaint that family doctors and general practitioners encounter routinely. It's a symptom that often brings patients through the door, prompting a thorough evaluation to determine its cause. And what about the general public? Well, it's estimated that up to a quarter of the adult population will experience chest pain at some point in their lives. That's 1 in every 4 people, a statistic that drives home just how common this complaint really is. But it's important to remember that chest pain isn't a condition in itself. It's a symptom, a signal from the body that something might be wrong. And the causes? They can be as diverse as the people who experience them. From heart disease and lung conditions to gastrointestinal issues and even anxiety, chest pain can be a sign of a myriad of different health conditions, both severe and benign. So what's the takeaway here? It's simple, chest pain is common, but it's not something to be taken lightly. Whether you're a healthcare professional, a medical student, or someone just trying to understand their own body a little better, it's essential to remember this. Indeed, chest pain is a common complaint, but its causes can be quite diverse. And understanding this diversity is the first step towards effective diagnosis and treatment. To comprehend chest pain, it is essential to understand the anatomy of the chest. The chest, also known as the thoracic cavity, is a complex structure composed of several vital organs and tissues. It's like a bustling city, each part playing a crucial role in the overall functioning of the body. Let's start with the heart, the power plant of this city. It's a muscular organ located slightly left of the chest's center, pumping blood throughout the body. Any disruption in its function can cause chest pain, often described as a crushing or squeezing sensation. Next we have the lungs, the chest's recycling centers. They're responsible for oxygenating the blood and expelling carbon dioxide. The lungs are encapsulated by a thin protective layer called the pleura. Inflammation or disease in the lungs or pleura can result in chest pain, usually sharp and worsened by deep breathing or coughing. The chest wall, akin to the city walls, is a combination of the ribs, muscles, and skin. The ribs protect the heart and lungs, while the muscles aid in breathing. Pain from the chest wall is often localized and can increase with movement or pressure. Beneath the surface, we find a network of nerves, the communication lines. These nerves transmit signals from the chest to the brain. If these nerves are irritated, it can lead to neuropathic chest pain, which might feel like a burning or tingling sensation. Lastly, we have the esophagus, a long tube running from the throat to the stomach, serving as the city's supply line. Conditions affecting the esophagus, like acid reflux, can cause a burning chest pain, often confused with heart-related chest pain. As you can see, the chest is a complex structure with many components, each capable of causing chest pain. Problems in the heart, lungs, chest wall, nerves, or esophagus can all lead to different types of chest pain. A clear understanding of the chest's anatomy will help us appreciate the potential causes of chest pain. So, what exactly can cause chest pain? Well, there are a multitude of reasons, and it's important to note that not all chest pain is linked to the heart, although that's often the first concern that springs to mind. First, let's talk about heart-related causes. Angina, for instance, is a type of chest pain caused by reduced blood flow to the heart. It's often described as a pressure or tightness in the chest, almost as though someone is standing on your chest. It's typically triggered by physical exertion or stress. Then there's the heart attack, which is when blood flow to a part of the heart is blocked, usually by a blood clot. This can cause intense pain in the chest, often described as a crushing or squeezing sensation. Other symptoms can include shortness of breath and pain radiating to the arm, neck, jaw, or back. Moving to the lungs, we can also experience chest pain from conditions such as pneumonia or pleurisy. Pneumonia, an infection that inflames the air sacs in one or both lungs, can cause a sharp or stabbing pain that worsens when you take a deep breath or cough. Pleurisy, on the other hand, is inflammation of the tissues that line the lungs and chest cavity. This can cause a sharp chest pain that worsens during breathing. Then there are musculoskeletal causes, like costochondritis. This is inflammation of the cartilage that connects a rib to the breastbone and it might cause localized chest pain that you can reproduce by pushing on the area of the chest wall. We should also mention gastrointestinal causes such as gastroesophageal reflux disease or GERD. This is a chronic disease where acid reflux from your stomach can cause chest pain that can mimic a heart attack. Finally, psychological causes like panic attacks can also lead to chest pain. A panic attack is a sudden episode of intense fear that triggers severe physical reactions, including chest pain, when there is no real danger or apparent cause. Let's not forget about conditions like shingles, which is an infection caused by the same virus that causes chickenpox, and can lead to a painful rash, often wrapped around the left or right side of your chest. Moreover, certain injuries, such as a broken rib or bruised muscles, can also cause chest pain. In some cases, chest pain may be caused by factors that aren't related to a specific medical condition. These can include consuming large meals, heavy lifting, extreme temperatures, or high altitude, which can all exacerbate or cause chest pain. So yes, the causes of chest pain are indeed varied, and they can be related to several different body systems. It's crucial to remember that chest pain is a symptom, not a disease. It's your body's way of telling you that something isn't quite right, and it's always worth getting checked out by a healthcare professional if you're experiencing persistent or severe chest pain. As you can see, the causes of chest pain are varied and can be related to several different body systems. How can we recognize when chest pain is a sign of something serious? Chest pain can be a deceptive companion. It could be a mere visitor, caused by something as benign as indigestion, or a foreboding harbinger of something more concerning like heart disease. Therefore, it's essential to understand the accompanying symptoms which might indicate a serious condition. First, consider the nature of the pain. Is it a sharp, piercing sensation, or is it a dull, heavy pressure? Sharp pain that worsens with movement or breathing could suggest a condition involving the lungs or chest wall. On the other hand, a squeezing or crushing sensation could hint towards angina or heart attack. Also, is the pain constant or intermittent? Constant pain might be indicative of a persistent issue, like an infection or inflammation, while intermittent pain might suggest a condition that comes and goes, like angina. Next, consider the accompanying symptoms. Shortness of breath is a critical symptom to note. If you're experiencing chest pain and find it hard to catch your breath, it could be a sign of a serious heart or lung condition. Similarly, sudden onset nausea or vomiting accompanying chest pain might be indicative of a heart attack. It's important to remember that not everyone experiences chest pain during a heart attack. For some, nausea or discomfort in the upper body might be the only symptom. Sweating, particularly cold sweat, is another symptom that shouldn't be ignored. Breaking into a cold sweat with chest pain could be your body's way of signaling a heart attack. Another symptom to watch out for is pain that spreads to other parts of the body. If the chest pain radiates to your arms, back, neck, jaw, or stomach, it might be a sign of a heart attack. Finally, remember that everyone's experience with chest pain is unique. What might seem like severe symptoms to one person might be mild to another. Therefore, when in doubt, it's always best to seek medical attention. Recognizing these symptoms can be crucial in determining the seriousness of the condition and the urgency of the treatment needed. What can be done to treat chest pain? This is a question that's likely crossed your mind, and the answer, like many things in medicine, is that it depends. Different causes of chest pain require different treatments, and it's crucial to identify the root of the problem to ensure the most effective treatment. Let's start with the basics. For chest pain related to heart conditions, the initial treatment often involves medicines to reduce the strain on your heart. These could include nitroglycerin to widen the blood vessels and improve blood flow, or beta blockers to slow the heart rate and decrease blood pressure. If the cause of chest pain is linked to a heart attack, immediate medical intervention is required. This could involve clot-dissolving drugs or procedures like angioplasty and stenting, where a small balloon is inflated inside a narrowed or blocked artery to restore blood flow. But not all chest pain is heart-related. If an infection is causing your chest pain, such as pneumonia or pericarditis, antibiotics may be prescribed to fight off the infection. In the case of pericarditis, anti-inflammatory drugs might also be used to reduce swelling in the tissues surrounding the heart. For chest pain due to conditions like gastroesophageal reflux disease or GERD, antacids or other medications to reduce stomach acid can bring relief. In more severe cases, surgery might be an option to strengthen the barrier between the stomach and esophagus. Now let's talk about chronic conditions. If your chest pain is due to something like angina or atherosclerosis, lifestyle changes can play a significant role in treatment. This could involve dietary changes, regular exercise, and smoking cessation, all aimed at improving heart health and reducing the risk of further complications. And of course, no discussion of treatment would be complete without mentioning pain management. Depending on the cause of your chest pain, over-the-counter pain relievers may be recommended. But remember, these are not a long-term solution, and don't address the underlying cause of the pain. All of these treatments have one thing in common: they're most effective when the cause of chest pain is correctly identified. And that's why it's so important to seek medical attention. If you're experiencing chest pain, it might be tempting to try and diagnose yourself or wait it out, but this can lead to delays in treatment and potentially worsen the condition. So, to wrap things up, treatments for chest pain are varied and depend heavily on the underlying cause. They can range from medications and procedures to lifestyle changes and pain management. But remember, the key is not to self-diagnose or ignore the pain. While many treatments exist for chest pain, the key is to seek medical attention to get the right treatment for the specific cause. Let's recap the main points about chest pain. Chest pain is a frequent complaint heard in hospitals, clinics, and emergency rooms across the globe. It's an ailment that doesn't discriminate, affecting people from all walks of life. Its prevalence underscores the necessity of understanding and recognizing this common symptom. The causes of chest pain are as diverse as the individuals who experience it. It can stem from a variety of sources, including the heart, lungs, gastrointestinal system, and musculoskeletal framework. Heart-related chest pain, known as angina, is one of the most serious forms and often the most feared. However, it's crucial to remember that not all chest pain is heart-related. Other common causes include conditions such as acid reflux, lung infections, and muscle strains. Associated symptoms can provide valuable clues about the underlying cause of chest pain. Shortness of breath, nausea, lightheadedness, or pain radiating to the arms or jaw can indicate a cardiac origin. On the other hand, symptoms like a sour taste in the mouth, cough, or localized pain might point towards non-cardiac causes. The range of potential treatments for chest pain is vast. It can be as simple as antacids for acid reflux, rest and physiotherapy for muscle strains, or as complex as surgery for cardiac issues. The key lies in timely recognition and appropriate treatment. In the end, remember, knowledge is power. Understanding the anatomy of chest pain, its causes, and the signs that differentiate various types can be crucial in seeking timely medical attention. Remember, chest pain is common but can be a sign of serious conditions. Never hesitate to seek medical help if you experience chest pain.